Hello, I'm Dr. Tanisha Singleton, Associate Faculty in the Media Psychology program here at Fielding Graduate University. I am very, very happy and honored to be introducing you into this presentation right now. I've said this before when I've been an advisor for Capstones, that this is always the most gratifying and rewarding experience for me when students are able to ask me to be their advisor to help them cross that finish line and take, something that they're very, very passionate about to the next level, and to, create this capstone, create this presentation, do all of this amazing research on something that they're passionate about, and to be able to share a passion with me is something I don't take very lightly. I think that's a huge honor, and so I'm always very, very humbled when students ask me to do that. And the latest to do so was Justin Purcell, who has been a top shelf student from day one, the multiple times that I've had him in classes, from, like foundations and community and fandom and all that good stuff. And his curiosity has always been the leading factor. And media psychology is great for that, because you're able to take a curiosity and then actually investigate it because of the interdisciplinary nature of it, and be able to connect these pieces that ordinarily somebody just walking by wouldn't think. Oh, it's virtual reality and homelessness and empathy. Oh, you mean games and narratives, huh? So it's actually very, very amazing that we have the toolkit and the mental capacity to be able to make these things happen and to present them in a way that makes sense. Because God forbid the shit we do actually makes sense. So I'm really, really happy and really, really honored to be able to not only be his advisor and guide him through this process, which is not easy. This is not an easy process. That's why not everybody has these levels of degrees, and particularly in this kind of subject matter. But again, very, very happy to, be his advisor through this process, and to also help cross this finish line so that he can, become a master of scholars, like the rest of us sweet people studying media psychology. So enough from me. Let me hand it over to Justin, who is going to give a brief, introduction about himself, and then take you through his slides here on enhancing empathy and understanding through virtual reality, perception of homelessness. So take it away, Justin.
Thank you. I appreciate it. And it's an honor to be here today with Fielding. With my past history of psychology and the physical sciences, and a career focused on health and well-being, I feel that media psychology is actually a vehicle that can help me make a better impact on improving the social wellness and physical well-being of the world around us. And with that, I'll just jump in. Today, I'll be discussing altering the perceptions of homelessness through enhancing empathy and understanding using virtual reality programs. Oops. Okay, there we go. Homelessness affects millions of people globally and continues to grow as a complex social issue. Traditional education and advocacy methods have struggled to change public perceptions and reduce the stigma associated with homelessness. Between 2022 and 2023, the homeless population in the U.S. increased by 12%, which marks the highest increase since 2007. Several factors, including end-pandemic era proportions, escalating housing costs, and shortages of affordable housing, contribute to the cause of homelessness. Most people consider shelter a basic human need, and addressing the current housing crisis requires greater empathy and understanding from national housing organizations and the public to develop initiatives and affordable housing plans. Virtual reality has gained recognition as a tool for enhancing empathy and is now considered an ultimate empathy machine. This capstone endeavors to explore how immersive technologies can increase empathy and understanding of homelessness as a social issue involving basic human rights. Perception of participants immersed in VR experiences is influenced through heightened senses gained during the experience. Media psychology provides a framework for understanding how interactivity can influence perceptions and reduce the stigma associated with homelessness. Increasing empathy and understanding is crucial to gaining support needed to address these problems in our society. And immersive technologies are proven to be a critical link between media psychology and the pursuit of social wellness. Using VR and principles of positive psychology, researchers can foster positive emotions like empathy, ultimately positively influencing users' future actions in volunteerism and philanthropy. In 2002, the Stanford University conducted a groundbreaking VR study to explore the potential immersive enhanced effects of these technologies in enhancing empathy, placing participants in the role of the protagonists facing homelessness. Stanford's Virtual Human Interaction Lab has previously examined how VR can influence empathic responses. This investigation found that over 8 weeks, 117 participants who completed VR perspective task courses developed more positive attitudes toward homelessness than those who didn't. And they also developed more positive attitudes towards signing a petition toward homeless initiatives at significantly higher rates than those who only imagined being homeless, or those performing less immersive tasks. This VR experience immerses users in the life of an individual facing homelessness due to financial difficulties and personal crisis, and guides the viewer through a narrative that outlines step-by-step process leading to homelessness. The VR experience guides the participant through losing their automobile, avoiding jail time, paying fines, meeting other homeless people, each having a personal backstory. The VR experience is not just passive viewing, but active engagement. It employs narrative storytelling to involve users emotionally and cognitively, making the experience more interactive and impactful. The gamified program places the user in the role of a protagonist who struggles to pay rent, sell belongings, cover bills, and ultimately becomes homeless. This active participation enhances the user's understanding and empathy. After the immersive experience, most participants reported being more willing to sign a petition to aid homelessness. The use of VR programs is making significant advancements toward the alleviation of mental health disorders by reducing anxiety and stress. Additionally, advancements in VR for post-surgery physical recovery have proven to be more effective than conventional therapy alone. Incorporating advanced technologies such as realistic virtual reality simulations that immerse users in real-life simulations can increase the effectiveness of media psychology studies in fostering positive emotions like empathy. Tracking future instances of volunteerism and philanthropy among participants can help researchers assess the impact of their work. By incorporating key principles of media psychology, we can significantly enhance participant interaction. This will help build a shared sense of social identity and emotional connection, fostering a sense of community that supports user interactivity. Narrative persuasion, gamification, and social identity theory, viewed through the lens of positive psychology, are integral to this case study and provide a foundation for guiding research. Positive psychology focuses on the strengths and virtues that enable individuals and communities to thrive. It emphasizes positive experiences, individual traits, and institutions. The Stanford study leverages positive psychology by embedding an underlying theme of hope and change. Integrating narratives that highlight resilience and recovery, focusing on individuals who overcome homelessness through perseverance, support, access to resources, can inspire hope and demonstrate that recovery is possible. This not only encourages users to support homeless initiatives, but also fosters a shift in perception. A strength-based approach, following the protagonist's strengths and coping mechanisms, such as navigating complex social systems, maintaining hope, and finding support, can effectively shift perceptions from viewing homeless individuals as victims to recognizing their resilience and resourcefulness. Narrative persuasion explains how storytelling can influence attitudes, beliefs, and behaviors. Engaging narratives can transport individuals into the story, leading to greater empathy and understanding. VR experiences that tell compelling stories of individuals facing homelessness can create a strong sense of present and immersion, making viewers more likely to empathize with the characters and understand their situations. For example, Stanford's Becoming Homeless: A Human Experience VR program uses narrative elements to depict the journey into homelessness, helping to break down stereotypes and foster empathy. Including detailed backstories in future studies can help users form a deeper emotional connection with the narrative, leading to long-lasting impact and support, with the formation of positive viewpoints regarding recovery prospects of homeless individuals. This emotional engagement can significantly influence participants' future behavior, increasing their involvement in volunteerism and philanthropy, and building on previous research findings. Viewer satisfaction with the digital story significantly influences their flow state, emotional healing, therapeutic experiences, and behavioral intentions. The flow state plays a critical role in mediating the effects of persuasion, enhancing the user's perception involvement, and it's really triggered by their real involvement with the emotional narrative and the storyline. Gamification involves incorporating game design elements in a non-game context to boost user engagement and motivation. Challenges and rewards through interactive environments can make experiences more engaging and impactful. The Stanford study demonstrates that integrating gamification elements into VR experiences about homelessness can enhance user engagement and cognitive absorption. Interactive choices in VR scenarios can help users understand complex decisions faced by homeless individuals, thereby increasing empathy and understanding. For instance, including dynamic decision points where the user manages limited resources, such as deciding between spending money or saving it for food or rent, directly impacts the storyline and outcomes, illustrating the difficult choices made by those who faced homelessness and actually the choices we all face, right? Utilizing standalone gaming VR headsets like Oculus Rift, which operate independently of a smartphone or computer. This can significantly enhance user focus and mental clarity. These headsets enable users to hyper-focus, detach from worries and anxiety, and become more absorbed in the present moment, enhancing the overall user experience. Social identity theory examines how individuals categorize themselves and others into groups, and this influences their behavior and attitudes. This theory underscores the significance of group membership and social context in shaping perceptions and actions. The Stanford study illustrates how VR experiences can utilize social identity theory by creating scenarios emphasizing common humanity and shared experiences between users and homeless individuals. By focusing on these shared experiences, users can form a connection with the protagonist in the storyline, thus reducing the us versus them mentality and promote a more inclusive perspective and foster greater empathy. In addition to these advancements in the role of media psychology and VR fostering empathy and understanding, these mediums are also utilized in exposure therapy to enhance well-being in PTSD patients. USC's Institute for Creative Technologies at the University of Southern California has developed a clinical free-to-use interactive VR exposure therapy tool. They call it Brave Mind, and it's used to access and treat post-traumatic stress disorder, which affects 7% of all war veterans. This is a significant concern for the military due to stressful experiences faced by soldiers in the modern war environment. Traditional graduated exposure therapy can be challenging for many sufferers as it relies on the patient's ability to imagine their previous experiences and remember them. Previous reports have shown that patients unresponsive to prolonged exposure therapy in the traditional manner have responded well to virtual reality exposure therapy using this Brave Mind program. Brave Mind allows clinicians to control multisensory stimuli and monitor patients' stress responses using advanced brain imaging and psychophysiological assessments. Interactive tailored environments can be created through VR technology, allowing precise control, documentation, measurement of stimuli, and patient responses. BraveMind not only aids in treatment, but also enhances clinical assessment and research by improving therapy outcomes of the patient as they adjust the intensity and pace of the pace of exposure according to the therapy level needed and the comfort level of each patient. Incorporating the critical components of producing empathy into VR experiments can significantly enhance their effectiveness in evoking empathic responses. Each element can be integrated to guide participants in improving empathy. Immersion in VR experiences can activate mirror neurons, which are responsible for understanding speech and the meaning of actions. This enables us to feel and understand the emotions of others. These neurons trigger similar emotional states in the user's mind, strengthening the empathic responses and creating a shared presence between the user and simulated experience. Immersing users in VR scenarios from another person's perspective allows them to experience events in another person as the other person. VR can simulate the daily life of someone from a different culture or tragic event, and this enhances our understanding of them. VR can present a complex social interaction through interactive storytelling, where users make decisions based on others' perspectives. This enhances theory of mind, which is crucial in fostering empathy and competence in moral reasoning. And actually, this helps, the theory of mind is what helps one person relate to another, right? Designing VR experiences with compelling narratives and expressive body language helps users form emotional connections with virtual characters. Immersive interactions These immersive interactions allow the user to deeply feel the other character's emotions, just as we were speaking before with the mirror neurons. Users can learn and imitate empathic behavior, just demonstrated by role models with the virtual environment, providing empathic responses in various scenarios. While VR can't directly influence hormone levels, its immersive technology, its immersive and emotionally engaging nature can foster social bonding and trust. And VR has shown to indirectly promote higher levels of oxytocin, which is associated with enhanced feelings of trust and empathy. Multi-user scenarios where more than one person are involved in the situation have shown to further increase oxytocin levels among participants. Heightened levels, this highlights the positive effects of both psychological and physiological well-being of users of these VR programs. Together, positive psychology and immersive technologies such as VR can have a more significant impact on media psychology research than either can achieve individually. Interdisciplinary collaboration creates more effective and comprehensive studies, leading to innovative research designs and methodologies that explain the scope of traditional media psychology. While VR experiences have significantly increased empathy and understanding among users, they can be further improved to provide a truly immersive experience. Currently, users have limited control over the storyline, and they have passive engagement with the simulation, with more of a passive experience, actually, with minimal opportunities to affect the outcome. This limited engagement restricts the user's sense of agency, reducing the immersive effects that enhance understanding and making the experience more realistic will enhance the immersive effects of future outcomes. I wanted to point out that we don't want to make it too realistic, because the mind won't believe it's real, and we enter this realm called the uncanny valley that the mind just it really knows better, and you're not going to get the enhanced immersive effects, but realism is important, and I think we lack the realism with the Stanford study. It's used with old technology, and we need to move into more futuristic realms. So in future studies, we need to provide participants with informed consent dealing with the experiment's outcomes and how the information will be used. Participants should be aware and consent to potential issues arising from VR studies, such as the use of headsets causing headaches, nausea, and time distortion associated with prolonged VR exposure. Comparing scenarios that outline different causes of homelessness can help researchers understand the effects of VR simulations on perception and their impact on participants' future behavior, especially in the terms of philanthropy and volunteerism. Before and after questionnaires can be designed to compare users' responses to different scenarios and assist the researchers in evaluating the impact of these enhanced VR experiences. The ideal questionnaire should measure empathy and understanding and willingness to volunteer. Potential confounding variables can be controlled through participant selection and random assignment. The interpersonality reactivity index for empathy is well established and can be used as a template for future research. Pilot studies can ensure that questions are correctly worded and measure the intended constructs, and substantiated findings increasing validity can be found through repeated measures. The Stanford experiment focuses on a linear narrative of financial hardship leading to homelessness, beginning with job loss. However, it does not delve into the underlying reasons for the protagonist's unemployment. Enriching the narrative by incorporating additional causes of homelessness, such as natural disasters, can provide more effective narrative transportation and provide a more profound experience for participants. Natural disasters are a growing cause of displacement and can provide a compelling and relatable context for users to understand the complexities of homelessness. Inclusion of real-time video and photography, combined with audio, places the user at the center of the narrative as it unfolds, adding an element of immersion that can lead to enhanced empathy and improved understanding. This increased relatability can positively influence users' future decisions regarding volunteerism and philanthropy, allowing them to identify with the narrative and build upon a shared social identity. Narrative elements that might result in reduced empathy, such as job loss due to drug addiction, can also be examined. Comparing different causal groups could provide valuable insights into how immersive VR gaming programs can effectively influence emotions. Nuances related to the cause of drug addiction can significantly impact the narrative's effectiveness. For example, an individual who's developed a dependency on opioid pain medication after physical injury, leading to deteriorating health and inconsistent employment, presents a different context compared to someone who purposely uses illegal drugs. These contrasting scenarios can influence participants' outlooks on homelessness and their empathic responses. By exploring these nuances, researchers can develop more effective VR programs that address various aspects of homelessness, drawing forth stronger empathic reactions. Further personalization of the narrative can help participants connect more deeply with the storyline. For example, consider Steve, a 42-year-old Army veteran, who on November 18th, 2018, in the town of Paradise, California, who was moving his belongings from a storage unit when a tragic wildfire hit the area. He was forced to take refuge from the intense heat and smoke inside of the storage unit, and he shut the door, leaving only a small crack for air. Paramedics found him 3 days later and rushed him to a local hospital that was 13 miles away. Steve's storage unit was one of the few structures to survive the conflagration. The wildfire destroyed over 56,000 residences and 13,000 businesses, including Steve's homes and workplace. With over 16,000 people reported missing and only 89 bodies recovered, the devastation was immense. Upon his release from the emergency room, Steve had nowhere to go and found himself hopeless and homeless. Suffering from PTSD, Steve struggled to maintain employment and his unemployment continued. His chances of securing houses dwindled, and to cope with his depression, he turned to alcohol. This exasperated his situation and kept him on the streets. The county where Steve lives lacks publicly funding mental health facilities, has a high jail recidivism rate for people experiencing homelessness, and along with high mortality rates among illicit narcotic users on the streets. Steve's story illustrates the complex, multifaceted nature of homelessness, highlighting the critical need for complex support systems. And inclusion of a story like this might help bring people a little bit closer and bond with the narrative. Stanford's Becoming Homeless, a View of Human Experience, has effectively increased empathy, but lacks deeper interactive elements and sensory feedback. Enhancements such as including realistic natural disaster scenes like wildfires in the gamified VR experience helps underlie the universal significance. Participants may already be predisposed to contribute to beneficial causes, reducing the need for extensive persuasive tactics and leveraging positive psychology. Reducing the need, incorporating various aspects of homelessness, such as emotional, financial, and social challenges into immersive gamified VR programs, helps the user capture the full scope of the issue, promoting greater empathy and motivating social action to address the growth of homelessness crisis. Realistic VR simulations will enable researchers to observe participant behavior in responding to media content while experiencing lifelike scenarios in a controlled setting. These simulations will allow researchers to collect highly accurate data and isolate variables that are often overlooked in the laboratory. By integrating media psychology and immersive technologies, previously unexplored research areas such as the effects of immersive storytelling or psychological impact of social interactions can be examined. Let me go back on. And here we see the tangible impact that brings the user directly into the storyline and helps them connect. That the entire community help pitch in, and it helps to show that the result in their future volunteerism will have a benefit and lasting impact on others. Dynamic narratives. Dynamic narratives bring the user directly into the storyline, as we've discussed before, and introduction of haptic feedback gives them the opportunity to feel more in a drastic way the things that a homeless person has to go through in their everyday life, such as lifting up bags and carrying them along. Integrating immersive virtual reality programs in media psychology research significantly enhances the field by creating engaging and educational experiences that deepen users' empathy and understanding of complex social issues like homelessness. VR can effectively alter perceptions, reduce stigma, and promote positive social action by leveraging positive psychology through narrative persuasion, gamification, and social identity theories, including natural disaster scenes like wildfires in the gamified VR experience, leaves no room for counter arguments. The narrative contains a universal sign embedded in it, representing the hegemonic viewpoint that all people understand and the consequences of wildfires, including homelessness and the danger of it to all people. Participants may already be primed to believe that their efforts should benefit others, reducing the necessity of persuasive tactics and leveraging positive psychology. Realistic VR simulations provide a controlled environment for researchers to observe and examine and also measure the effects of media content on behavior. This can yield new insights and highly accurate data. This innovative approach expands the scope of traditional media psychology in enabling the exploration of previously unexamined areas, such as psychological impact of immersive storytelling and the virtual social interactions that are involved. Ultimately, the synergy between VR and media psychology can lead to more effective strategies for addressing social issues and fostering greater empathy and understanding overall.
Well done. Well done. It's a lot, right?
Well, I feel like I messed up a couple times, and
Yeah.
then like I had to catch back on and start like reading it because I felt like I was delivering better with that, relying on that.
Yeah, no problem.
And then I have a few tongue twisters and some dry throat issues.
Yeah, no worry. It have what you mean you're
But,
human? How
but
dare you be
and
a
then
human?
toward the end, I got like off a slide, and I think that happens too. But I did get off a slide, and then I kind of went back, and then I kind of skipped forward, and but
Sometimes those are the things only the speaker knows
and it's there.
because it's yeah, it happens with reps,
And I
and
went back. I went forward a slide, talked all about it. Then I went back, and I had to talk about this one a little bit to move on.
it's okay. It's okay. Because I'm
But
telling you, it's one of those things that, when I've done public talks and presentations before, you're the only one who knows that. Like if you just kept going, like the audience doesn't know that you skipped a slide. You know what I mean? So it's one of
right,
those things. It's like you have because you own this stuff. And when you know that you own it
right,
and you have that confidence, then you're able to make the connections and tie things together. But nobody knows the background of it. It's like, what's forward, what's backward, all of that kind of stuff. But that's the stuff that just comes with, repetition and doing it over and over and over again and doing all of that kind of stuff. And um, but you still did great. You
right. And
still
then I
did
slow
great.
down because I'm thinking about thinking while I'm thinking, and that's too much
It's
critical
yeah,
thinking when
it's
I'm trying to get something done.
I've seen it crush people in public on stage. I've seen them like, ooh, where you just feel bad. I've seen it happen where like people ran off the stage and I was like, fuck, and that hurts. But again,
Oh,
it's all with practice and stuff. And so you did great. You did great. I know. And like when dry throat and tongue twisters is like, oh God, it's like, oh,
it just
yeah,
pushes you forward, and
push
you
through.
about what it is that you need to cover right there.
Sure. Push
Right,
through. And you
right,
did. Great job.
right.
Great job. Um, I did want to ask you a couple of questions because I know there was so much that you wanted to be able to include, and in your capstone does a great job at being able to what you were doing towards the end here, looking at the suggested areas of future research and other considerations, and certainly the stuff about uh consent, informed consent, and letting the participant or the user in on and everything, and making sure that they're comfortable. Brave Mind, uh that USC lab I told you about from that Skip Rizzo runs, um that was one I remember. I met him like, oh damn, what is this, 2024, so like maybe 10 years ago or a little less, when he came by fielding because he was a buddy of another faculty member who's not in the program anymore, and he was talking to us in person about this lab and working with veterans. And I have a vested interest in it because my dad was a veteran, Vietnam, and injured and suffered from PTSD till his last days. And um Skip always said that this VR therapy for PTSD, it was always a companion to actual therapy. It was a companion and something that was monitored and supervised by a clinician, by a therapist, right? So it wasn't the only thing that was being done. It was always paired
Okay.
with a licensed counselor, physician, whatever, and dependent on the user's reaction, scale it back if it's too much too soon, or scale it forward if it looks like it's
Right.
working, progressing, right?
And they can have differences. Some could be on medication or otherwise. They could each
100%.
have different,
A
you know,
100%.
everyone has a different situation.
Yeah, and it can change. It can fluctuate. The same person may, go back and forth. It just that's the
Right. Some may be treated a little bit more
aggressively
stringently,
or
right, aggressively. Some may be just like kind of in on it. Right.
yeah.
We don't
That's
know.
the scary part or the challenging part rather, because we're dealing with humans and humans can be unpredictable based on, so it's not a copy and paste kind of thing with so I was going to ask like maybe along those lines, or did you see something that Stanford case did, or what would you along those lines of like how to monitor or what needs to be done in a development standpoint before something like this is launched or presented to try and keep those checks and balances in order because of how unpredictable
And on
things
that, I would go right back into the research and development of the technologies itself, and leave it upon the companies that are producing them to develop more safe and effective strategies in like in harm reduction, right?
mm-hmm,
The harm reduction of their own product to show that, oh well, we've got a product that doesn't cause headaches, doesn't cause dizziness over time, doesn't make you lose your sense of perception or give you any kind of vertigo, right?
mm-hmm,
so
mm-hmm,
so in those regards, it has to do with the long-term exposure to that product, and that
mm-hmm,
product utilizes light waves in,
mm-hmm.
into your eyes, and so when you have these light waves coming into your eyes, maybe there's another way that they could have a filter glasses or something that might help protect you from some of the nauseating experiences that people might observe.
Yeah, and
Uh,
because two bodies are going to be completely different, right? It may give one person a headache and the next one not, right? But
right.
like you said, in the development stage, like of the tech and the design of the experience itself, being able to have those customization settings, those features, that personalization, so those individual things like light or perception or something, you know what I mean? You're able to scale it dependent on the individual's reaction and almost in real time be able to scale those kind of things back.
Exactly. So it's not a problem that psychology itself is going to cure, but it's a race for a better product.
Yes. Yeah. Yeah. That's great.
That's
That's
how I
great.
kind of view
For
it.
sure. That's great because yeah, it does take that in the development stage of those things, being able to make sure that in real time as an experience is going on, that you're able to kind of, dial things back and almost look at the reaction and be able, almost like a producer in the control room, right? Of a TV show, being able to move the camera back, slide this, move that, da, da, da. It's like you're almost able to like manipulate the experience in real time based on the human reaction. It reminds me too, I don't know if I showed this to you. Maybe I did it in class, not during this capstone, but there was that VR experience, the series about the nuclear disarmament, the false nuclear threat that happened in Hawaii on the morning you wake. Did I tell you about that like a while ago? I'll send it to you afterwards. But so it was an impact campaign that I worked on last year for a client of mine from Games for Change. It's a 3-part VR series called On the Morning You Wake to the End of the World. And it's about the real false missile threat that happened in Hawaii back in 2018. If you remember, so back in 2018, everybody got a text message that was like, this is not a drill. Nuclear bomb incoming, seek shelter, good luck kind of
Right.
thing. In other words, like, and you know how you get the Amber Alert and it all just comes in like regardless. So it was one of those. Like everybody in Hawaii got this text message and everybody's like, the
Yikes.
hell? So the people on the news are like, I don't know. And people are calling 911. The operator's like, I don't know. I got it too. Like, so for 37 minutes, everyone was freaking out. Everyone was texting their mom, I love you. People are grabbing water and going in garages and shelters.
No.
For 37 minutes, everyone thought a bomb was going to drop on Hawaii and everybody was going to die.
Right.
On like the 38th minute, another alert came in and was like, false alarm. Sorry, carry on. Go about your
I
day.
wonder who hacked that one in.
And so everyone was like, you fucking serious. So traumatizing, right? To think for 30 some minutes, like you're going to die and in the worst possible way.
It's horrible.
And so that was such a, I mean, everyone's reactions to it were kind of different, but that because of that, there were some poets and VR and some immersive screenwriters and stuff. So they made this VR series called On the Morning You Wake, and it's from testimonies of real people in Hawaii who went through that experience, giving their testimonies, giving what they were thinking, all of that kind of stuff. And the point of the series is about nuclear disarmament, trying to educate people or gain awareness about nonproliferation, the treaty, what can we do to eradicate nuclear weapons across the world? How do we get every country to agree? Look, we are not, you know what I mean? So this was an impact campaign that I worked on with this company and launching this out. And we took that documentary to high schools, to colleges, to the Nobel Peace Center. We went to ICANN in Vienna. The went all over the place. I think we did about 200 different sites, and we produced we worked with other PhDs then to try and measure which was more effective in creating awareness and inspiring action, VR or 2D, because we let some watch it in VR, we let some watch it just on an iPad. And the way that we were able to measure this was that we did pre-screening surveys where we asked the participants, have you ever been in VR before? If you have, what was it? How long? Like we asked all these pre-screening questions, and then a post survey, like a post-experience survey, where we were like, okay, well, now that you've seen this on a scale, Likert scale, what do you, how much more aware do you feel about this? Do you feel more inspired to do something? Do you, right? So behavior-based kind of questions to see. And VR was higher in terms of the emotional impact it had on participants. So it took this was just one survey or one case, right, that we did with this particular project and about nuclear disarmament specifically.
Okay.
So it's interesting, and I thought about that listening to your presentation right now, because on this topic of safety, right, of the user and wanting to, we have a goal, right? We want someone to watch this and be more empathetic and to inspire some type of behavioral change so that we, as a human rights issue, right? It's a long leap on paper, right? Watch this, no more homelessness, right? There's a lot that goes on in between those two things. So for this study, yeah, from the developer stage to the producer side of it, right? What type of pre-questionnaire do you need to do? What questions do you need to ask? And then after the experience, right? How do we know how it changed them? How do we know what they're thinking? So those type of post-experience questionnaires, like we did with the nuclear bomb piece, are integral, I think, are really, really important. Those are important components that developers and, the clinician or, the media site producer, those that are behind this kind of campaign, those are other considerations, I think that need to be made.
I feel it is a really important issue that deserves attention for social change. Just in our local community here, even with the impact of what's happened and the growth in the homeless rate across the United States, they're bringing out the bulldozers, and people are forming onto private property if they can. They're going into parks and ravines and anywhere they can fit these homeless encampments into. But eventually the sheriff's department comes in and with their bulldozers and their work crews just eradicates and clears everybody's belongings. So now you have all these homeless people out on the streets that are literally nothing now, that their parents' ashes and things are being swept into the trash, their keepsakes, their final belongings are gone. What does that do to a human psyche? What does that do to tear down the individual? Now we're not building our society, right? Because we're tearing our society further into shambles when we do these small things. So we have to, that money spent could be used for other things. And, public opinion is a very crucial factor in this. And that's what gets people elected.
Ain't that the truth, right?
So,
Is there anything else you would like to say kind of about this piece, or where you think this will kind of take you in the future, this particular, not only just this subject and homelessness and
So
stuff, but just
good
in general?
investigative reporting
Sorry,
uncovers
where'd that come
truth.
from? Videos popping up on my screen.
Not particularly. I mean, I feel it's a good place to end it. I feel accessibility
Yeah.
and inclusivity are really important. So there's a price barrier for a lot of these technologies for a lot of people. A lot of people benefit from the help of them, such as the people with disabilities and health issues. Those people might not make a lot of money, so there's that barrier. Things should be done in a clear social context, right? So that they can be culturally appropriate, cultural relevance to the people that they're aiming the whatever content it is through. And I agree with Skip Rizzo that, I mean, if it can be changed and affected through media technologies, then this VR is the way to go.
Love it. No, great job. Great work. Great work. Great place to end it, like you said. Well, let me be the first to tell you, welcome to the community of scholars. Congratulations. You've done a fantastic job. This is a vitally important subject, and one that you've certainly presented a wealth of knowledge and passion for, that is only going to be for everyone else's benefit because of the human rights element of this and social good, and being able to use tech for good in this kind of case for social issues and social justice. So congratulations once again.
Thank you.
You're very welcome.